Primary headaches, while sometimes debilitating, are not life-threatening. But some of the conditions that cause secondary headaches may be.
Many people with headache wonder if and when they should go to the doctor. And really, I think there are two broad reasons to go to the doctor. One is if the headache might be symptomatic of some serious underlying condition. And the other is if the headaches are interfering with your life to a degree that warrants medical treatment. So in terms of the first category, headaches that are symptomatic of an underlying condition, there are a number of warning symptoms or alarms that suggest the headache may have a serious cause.
A change in headache pattern for somebody, or a progressive pattern to headache. Instead of having headaches that are intermittent and you're fine in between, all of a sudden the headache is there every day and getting worse, or sort of an escalating pattern. So a change in pattern is something that would concern me. Some form of neurologic dysfunction, such as double vision, loss of vision, weakness on one side, hearing abnormal sounds.
Headache associated with fever or stiff neck or uncontrollable vomiting could indicate meningitis. If headaches are associated with confusion or loss of consciousness, that's a reason to seek medical care. If headaches have changed in character or begin after the age of 50 or begin after a head injury or another form of trauma, again, those are reasons to seek medical care because the headache may be a marker of some underlying illness.
I just always assumed that what I was having were allergy and sinus-related problems, and it was interesting because I wasn't just getting these sinus headaches when I had sinus infections. I would also get these awful headaches at other times.
A true sinus headache is caused by sinus inflammation. However, when a headache occurs that involves the sinuses, it is important to consider the possibility that they are actually migraine or cluster headache.
Many people who have migraine headaches are told that they have sinus headache. If someone has a sinus infection, that can be a very powerful cause of headache. Very often there's tenderness over the sinuses. Very often people run low-grade temperatures, they have discharge from the nose, and that's a condition that requires antibiotics. But when people have recurrent severe headaches associated with sensitivity to light or sound or associated with nausea, as in this patient, those headaches are much more likely to be migraine than sinus headache.
No one would contest the fact that an acute sinus infection can cause a headache. But it is unusual for an adult to have recurrent sinus infections causing headache, and chronic sinusitis, meaning a problem in your sinuses all the time, is usually not associated with headache. I insist that a diagnosis be made, and that usually means the patient should have a fever. If you percuss over the sinuses, it should be painful. Often they have laboratory abnormalities like a high white blood cell count. Imaging of the sinuses by plain X-ray or CT scan should show an infection. And if you have those things and drainage from the sinuses, then I'm willing to say, yes, there was a sinus infection and it should be treated as such. But often what I'll see is the patient goes to the doctor's office complaining of a sinus headache, and the diagnosis is simply made because the patient says they have a sinus headache, and instead of treating the underlying problem, the patient is exposed to inappropriate antibiotics, sometimes for years.
I spent more time than I should have treating them with Fioricet and painkiller kind of things.
The great irony of headache is the same medications we use to treat headache and relieve the pain can become a cause of headache if they're overused.
Medication overuse headache is an epidemic in this country. There may be 4 or 5 million Americans who have a headache every day, who happen to be migraine sufferers, whose daily headaches are caused by the medications they take. There are a large number of medications, both prescription and non-prescription medications, that when overused by migraine people convert intermittent migraine into chronic daily headache, where they have a background headache all the time that looks like a tension-type headache with spikes on top of it that look like their old migraine. And these are the people who invariably will tell you that they're taking more pills and having more headaches. And pretty much the only way to get them better is to get them on less medication.